Hello everyone. We are here today to represent Jacksonville University School of Nursing Bachelor's Program, and we're going to present the role of informatics in reducing health disparities. This presentation is brought to you by Kina Atencio, Kellie Cirilli, and Elizabeth Andrade. What is health disparity? Health disparity is when a health outcome is seen in a greater or lesser extent between populations, such as race or ethnicity, sex, sexual identity, age, disability, socioeconomic status, or geographic location. Let's talk about racial and ethnic concerns first. Minorities have lower levels of access to medical care in the U.S. due to higher rates of unemployment and lower paying jobs that include health insurance as part of the benefit package. Ethnicity of patients may affect their ability to communicate and explain their illness, resulting in misinterpretation on the part of the health care provider. Gender concerns. Women tend to have lower paying jobs, resulting in low quality or inadequate health insurance. Lack of preventative care, such as GYN, breast cancer screening, and prenatal care. Increase in women as the head of the household is a current tendency, with children resulting in poverty or low income and poor health insurance and coverage. Sexual identity. Social inequality, stigma, and discrimination resulting in difficulty obtaining adequate health care. Increased health risk as a risk and result of sexual orientation. Age and disability. Inadequate health insurance coverage for individuals over 65 due to cost. Increase in medical conditions and inability to afford treatment. Unemployed, increased risk factors such as obesity, lack of physical activity, and lack of accommodations required for effective communication and physical access. Socioeconomic status and geographic location. A lack of education and employment and inability to purchase health insurance. People who live in poor, overcrowded communities with higher rate of violence and environmental pollution. They may live in areas with low quality providers or lack of providers, and also based on poor health care decisions. National Healthcare Quality and Disparities Report. The data supports that healthcare and quality are suboptimal, especially in minority populations. Quality is improving, but access to healthcare is not. Health disparities overall are not improving. Disparities in access to health information services and technology may cause lower usage rates of preventative services, reduced understanding of chronic disease management, increased rates of hospitalization, and poorer overall health status. So let's review. Number 1, which of the disparities below can influence a health care outcome? A, disability, B, race, C, geographic location, D, all of the above. Correct. D, all of the above. Number 2, someone who lives in a gated community in the suburbs is most likely to experience an inequality in healthcare services. A, true, or B, false. The correct answer is B, false. Explanation. Disparities are more likely to occur in poor, overcrowded communities with higher rates of violence and environmental pollution. Our next section is where informatics is going in healthcare. And this is pertaining to the nursing discipline. The definition of nursing informatics is it is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. Such as the electronic health record, or EHR. This integrates all medical patient information into a lifetime record. The adoption of the EHR by 2014 as a means to help transform U.S. healthcare and provide a lifelong EHR for every citizen. An EHR does the following. It improves patient care coordination, patient safety, productivity, contains costs, and decreases wait time for treatment. Also, the computerized physician, provider, or prescriber order entry, the CPOE. As orders are entered directly by the nurse practitioner, the PA, physician, or other provider into the computer, this practice will eliminate miscommunication caused by illegible handwriting, allow the computer to check and compare orders to prevent repetitive orders being entered and/or performed, speed up the process of implementation of ordered diagnostic tests and other ancillary devices, and promote safety. It will decrease adverse drug effects by checking for correct doses, drug allergies, and medication interactions, save money, and communicate the status of current orders. We also have the Picture Archiving Communication System, or PACS. A picture archiving communication system used for X-rays, MRIs, ultrasounds, and CAT scans can transport images digitally to allow immediate diagnosis of images by a radiologist, allow the provider to view images and compare before and after images for continuity of care, save money and space as the records are no longer stored on film and required to be filed. All info is retrieved through computers and digital images. Save time by reducing radiology techs having to develop images and transport to physicians for interpretation. Future of healthcare informatics. Future technology will incorporate all possible aspects of patient information, from trending vital signs over a lifetime to the most desirable treatment for the best possible outcome. It will consider the entire spectrum of an individual's known identity. Patients will make predetermined decisions concerning the divulgence of private data for treatment purposes. Wireless patient-to-treatment device interface will define the norm for healthcare practice. Nanotechnology and stem cell manipulation, working in concert with a patient's real-time preferences and imagination, will make the question of recovery into a rhetorical and archaic idea. So let's review. Which 3 reasons below are good reasons for using the CPOE system? Select all that apply. A. Speed up the process of implementation of ordered diagnostic tests and other ancillary devices. B. Save money. C. Decrease adverse drug effects by checking for correct doses, drug allergies, and medication interactions. Or D. Increase safety risk for patients. The correct answers are A, B, and C. Number 4. Future technology will incorporate all conceivable aspects of patient information, from trending vital signs over a lifetime to the most desirable treatment for the best possible outcome. A, true, or B, false? The correct answer is A, true.
Oh, no. Just keep going.
Okay, how to keep going?
Press U again, and then the switch back.
Plans for decreasing these healthcare disparities. The Affordable Care Act was signed into law in March of 2010, and its main idea focuses on health promotion and prevention. It relies heavily on a properly trained workforce in order to provide adequate services to the public, particularly those with less access to health services. Current challenges: the economic downturn, a decreased workforce and inadequate training, decreased funding for public health services, and uneven distribution of funds in areas of most need. Some current progresses are grants for community-based programs and funding for education of future healthcare workers. Some additional government efforts are Health and Human Services allocating $400 million to fund data infrastructure. Also, health information technology, from the government's point of view, is now seen as a tool for improving efficiency and safety in healthcare, as evidenced by the VA Veterans Affairs hospitals taking a leadership role in developing an information network. And lastly, healthy people. Goals over the decades. Some of their goals, beginning back in 2000, were to reduce health disparities among Americans. In 2010, they changed it to eliminate, not reduce health disparities. And in 2020, they are hoping to expand and achieve health equity, eliminate disparities, and improve the health of all groups. Some of the healthy people goals as they relate to informatics are push to make internet and mobile access more accessible, facilitating the use of health IT and exchange of health information between healthcare and public health professionals, progressing the public health information infrastructure, familiarizing health professionals and the public to the changes in healthcare efficiency due to the use of health communication and health IT, helping put multidisciplinary models and data systems in place. So let's review. One of the current challenges for the Affordable Care Act includes A, even distribution of funds to the most needy, B, grants for community-based programs, C, a decreased workforce, or D, funding for education of future healthcare workers. The correct answer is C, a decreased workforce. Number 6, facilitating the use of health technology between healthcare and public health professionals is one of the healthy people goals. Correct answer is true. So in conclusion, informatics will serve to reduce health disparities by a reduction in medical errors, promotion of quality of care, make better use of resources such as time, money, and healthcare personnel, improve population health for all. Our political institutions are currently taking steps in the right direction to provide a framework for network patient-centered healthcare. Thank you.